Hello, my name is Eric Skarsgard, and I'm an associate editor for the World Journal of Pediatric Surgery, and I've had the honor of editing a special issue of WJPS dedicated to congenital diaphragmatic hernia. CDH remains one of the most interesting congenital malformations to challenge pediatric surgeons over the last half-century. During that time, our understanding of CDH has evolved from a hole in a muscle treated as a surgical emergency with a 50% survival rate to an antenatally predicted derangement of newborn physiology treated by expert multidisciplinary teams in which surgery plays an essential but supportive role. This special issue dedicated to CDH includes state-of-the-art review articles written by thought leaders in the fields of maternal-fetal medicine, fetal imaging and in utero intervention, neonatology, cardiology, medical genetics, pediatric surgery, and pediatric anesthesia. The first two articles address the important subject of prenatal diagnosis and prognostication and the recently validated field of in utero intervention. The fetal therapy article delves into the history of fetal surgery for CDH from the early proof-of-concept animal work of the 80s and early 90s to recently completed randomized control trials for moderate and high-risk CDH. Due to advances in genetic diagnosis, we are increasingly aware of the coexistence of genetic with somatic malformations, and this is especially true in human CDH, in which 30% of cases have a genetic association. The article on genetics in CDH reviews the functional investigation of signaling pathways on diaphragm and fetal lung development and explores the relationship between CDH genetics and potential environmental modulation by factors including vitamin A and the retinoic acid pathway. The evolution of lung protective ventilation, beginning with early observations of improved outcomes with gentle ventilation, is summarized in an excellent article on ventilatory management. This article summarizes the current state of knowledge on the use of conventional and high-frequency modalities and offers a recommended strategy for ventilation for CDH from birth through to recovery from surgery. Another innovation in CDH care has been the emergence of bedside echocardiography performed by neonatologists as a point-of-care tool in allowing targeted intervention for cardiopulmonary dysfunction. The article on hemodynamic management describes the various phenotypes of CDH pathophysiology and provides a comprehensive and contemporary review of the classes of medication used to treat pulmonary hypertension and ventricular dysfunction. The special issue includes an excellent review of surgical repair of the diaphragm with an emphasis on repair options for large defects not amenable to primary repair. There is also a detailed update on the safety and effectiveness of minimally invasive surgery, which is a much more acceptable alternative now that the high recurrence rates observed initially seem to be trending downwards with improvements in technique and patient selection. While the role of ECLS is firmly established in treating patients with severe pulmonary hypertension or ventricular dysfunction, improvements in ventilation and hemodynamic management have led to an overall reduction in ECLS utilization. However, once a patient is on ECLS, provider teams face the dilemma of when to repair the diaphragm, recognizing that there are competing risks and benefits to repair on versus after ECLS. This is addressed in an excellent review of the role of ECLS in CDH care, which interprets the current literature to make recommendations on timing of repair, with an emphasis on the importance of avoiding non-repair. With improved survival, the focus of outcome improvement in CDH has appropriately shifted to the health and quality of life outcomes of survivors, which is only possible when patients are followed systematically. The article on long-term follow-up provides an excellent state-of-the-art summary of long-term functional surveillance and outcomes by organ system and includes a thoughtful discussion of transitioning CDH survivors to adult care. Last but not least, the issue concludes with a thoughtful article on the role of standardization as an optimal care strategy in CDH. This article summarizes the multidisciplinary collaborative processes used by the CDH Euro Consortium and the Canadian CDH Collaborative in creating their respective evidence-based consensus guidelines. It includes strategies for guideline implementation and performance measurement and highlights the importance of a commitment to updating or evergreening guidelines as new evidence emerges. I'd like to take this opportunity to thank all of our outstanding authors who worked diligently to create this excellent collection of articles dedicated to the diagnosis and treatment of CDH. Looking forward, it is certain that continued innovation with contributions from discovery science and artificial intelligence will play key roles in improving the quality of CDH care for future patients and their families. I hope you enjoy reading this special WJPS issue on congenital diaphragmatic hernia. Thank you.